Hi, my name is Ronessa, and I'm an undergraduate student in the Connect Lab. Today, I will be presenting the preliminary results of a systematic review investigating the efficacy of non-pharmacological persistent pain treatments for youth ages 6 to 21 with mental health comorbidities. Persistent pain is a condition that most attribute to the elderly, but did you know 11 to 38% of youth in North America are living with this condition as well? Of that population, up to 29% of youth also experience a severe mental health disorder, most commonly depression or anxiety. The effects of persistent pain can be so severe and lifelong that some children are unable to go to school, play with their friends, or even watch their favorite movie. To help children manage their pain levels, most professionals recommend interdisciplinary non-pharmacological interventions. These interventions do not include the use of drug treatments and instead rely on the collaboration between healthcare professionals such as physical therapists, psychologists, family doctors, and many more. Non-pharmacological interventions are the preferred and safest approach to treatment as they avoid harmful side effects or dependency disorders from drugs. We started our investigation with a search strategy of over 100 terms such as persistent pain, depression, and cognitive behavioral therapy. We then applied these terms to 4 medical databases to identify peer-reviewed randomized controlled trials. Our search yielded 9,620 papers, 12 of which were included for final extraction. However, these results are subject to change after a second evaluation of the data has been conducted. We extracted results regarding study design, mental health, pain intensity, sleep, quality of life, physical role, and emotional functioning. The most common form of intervention found were mindfulness and exercise programs. In terms of risk of bias, studies consistently showed low risk of bias for the randomization process and higher risk of bias for measurement outcomes and reported results. Thus far, the results of our study have not found evidence to suggest that non-pharmacological interventions are not effective for children with persistent pain and a comorbid mental health disorder. However, this topic has not been sufficiently looked at. Only one study assessed mental health using the DSM-5 criteria, and the others opted for a self-report measure with a mental health threshold. This may lead to an inaccurate representation of mental health comorbidities in youth with persistent pain. Another obstacle encountered was the large variability between studies, making it challenging for meaningful comparisons to be made. Nevertheless, these observations have allowed us to make informed suggestions for future research. First, we strongly advocate for the use of consistent measures across studies. There is also a need for the inclusion of formal mental health assessments and for studies to distinguish between participants with mental health comorbidities versus participants without. Without this method put in place, the question of how effective are non-pharmacological interventions for youth with persistent pain and a comorbid mental health disorder cannot be answered. The next steps of this research will be to complete a second evaluation of the data, as well as a formal write-up and possible meta-analysis. We will also devise a plan to transfer our findings to clinicians, researchers, and the general public. The lack of clarity regarding non-pharmacological persistent pain treatments for youth with persistent pain and mental health comorbidities may act as a barrier preventing children from receiving equitable and high-quality care. The Get Up and Go program at Holland-Bloorview provides an opportunity for this type of research to occur here at Holland-Bloorview. For more information, come visit my poster, scan its QR code, and click its link for an accessible information sheet. Thank you.